It's so important to know that hope exists and solutions exist. It's also critical to realize that not any one person or organization can address this issue by itself. The heart of our work is about getting reliable, quality information and resources into the hands of our partners, and ultimately ending the addiction crisis in our country.
My son Hagen, at 15, he started smoking marijuana. As he got into his later teens, he started basically just experimenting with most anything that would numb his pain.
When I was in college, I became addicted to painkillers. I ended up homeless. I had lost a lot of friends, and I ended up becoming pregnant my senior year. And so it changed the trajectory of my life.
My son Harris was diagnosed with an anxiety disorder when he was 3 years old, ADHD when he was in 8th grade. 11th grade came, went to a party in my town, prescription pills were available on the table, and that's when I could say for us the game was over.
Hagen and I remained close, and that last weekend was his last hurrah. And he did a lot of cocaine, and it had 5 times the lethal dose of fentanyl in it. And he was dead within 2 minutes.
I realized I was neglecting my son and could not hear him crying, and my mother got up and I could see the desperation in her face that I needed to change, and I knew it was time for me to change.
Within a year and a half before Harris died, he was in 4 substance use inpatient programs, 2 substance use outpatient programs, each saying he had this thing called co-occurring disorders. None of them ever got to the mental health piece. I'm going to figure out where this went wrong.
We know that solutions exist. We've been doing this work for more than 30 years now. In particular, there's 3 things that we know have to happen, 3 imperatives. The first one is on preventing and delaying use for as many young people as possible. The second one is getting quality treatment to everyone who needs it, especially young people. And the third imperative is making sure that we're helping every parent and caring adult in this country know what they can do to make a difference for their children and their loved ones.
After Hagen passed, I thought something has to change. We started creating the Hope Movement Coalition, and at first it was just about that connection that I had been so desperate for.
I formed Andrea's House because there had to be more that I could do. And so I wanted to create a safe haven, just not for mothers, but for their children as well. And I also wanted to bridge the gap between the mothers and the system for those mothers who had lost their children due to their addictions.
I can either look back and think about what I lost, or I could choose to accept the mission and find ways to transform the system of care. So while I eulogized my son at his funeral, I also launched the Harris Project.
We've been really fortunate to have our paths cross with Stephanie to develop a program, a curriculum for young people to raise awareness about co-occurring mental health and substance use disorders. And the goal ultimately is to bring it nationally or even internationally if we can.
We at Hope Movement recognize that so many of us didn't have what we needed while our child was struggling. I was one of those people.
We have partnered with Stacy, who's created a text messaging platform to connect with other parents who have lost their child due to overdose.
So when they text us, we say, how can we help you? And they have 2 choices. I've lost a loved one, or I have a loved one struggling. And if they have a loved one struggling, we send them directly to the partnership.
My hope for this collaboration would be that this will be a place where families could come to gain resources and life-saving information.
Currently at Andrea's House, we've helped about 68 families, and partnership has been absolutely vital. The resources, the advocacy, they're tying all of that into families, and it's making a difference. It's making a huge difference.
We had this wonderful opportunity to work with Paramount, particularly focusing on recovery and how recovery works. And that's how we first met Carlea. We highlighted her in our documentary, and she's just such a fabulous spokesperson and advocate herself as a person in recovery. But the work that she's doing and the number of women and families that she's touching is just remarkable.
I'm really, really proud to be a part of this organization, and I jump up every time I'm asked to do something because the amount of women getting their children back and the lives being changed through Andrea's house, I look at what Partnership is doing and the lives they're touching, and that is what it's all about, letting people know there is endless second chances in addiction.
There needs to be a certain leap of faith in this space when you're doing this for the first time, and sitting with professionals who so clearly recognize the value of the work. Why wouldn't you want to work with them? You know, they're the organization that can really help amplify it, give it credibility. It was just abundantly clear that this was the group that was really going to help make it happen.
The partnership knows that we can't do this alone. We've got advocates in nearly every state in this country, and our mission is to get the great information that they need into the hands of their communities.
We're focused every day on bringing our strengths and our skills to help others across the country, and we're committed to building partnerships that are going to result in positive outcomes and ultimately ending the addiction crisis in our country.
Prevention, treatment, and parent engagement, the three keys for solving the crisis. No group of people is more committed or experienced in these areas than the staff at the Partnership to End Addiction. As the chairman of the board, I thank you for all of your generous support of the Partnership's mission to end addiction in our country.